this video, let us look at pharmacology practical record. So here you go. This is general pharmacology. What and all you have to do. Experimental pharmacology usually will be rabbit eye. They have written this, but you actually will do it on a simulator, just on a computer. You have a rabbit, and on that you will put the eye drops which contain this semiotic, mydriatic. You will see the eye dilate or not. It's a computer software which does it. We are not doing anything to the rabbit or the frog or the dog or anything. Then clinical pharmacology, how to write prescription, and if somebody has some problem, what and all will you prescribe, fixed dose combinations, what are the benefits, like leprosy and tuberculosis, you have fixed dose combinations, isn't it? So you can reduce the compliance will improve, and what else, the resistance of the bacteria will also not develop, and also the patient will not be communicability of the disease will reduce, etc. Museum visit, what is this? So in museum they would have kept a lot of tablets. You'll have to look at the tablets and identify them. Spotters, they have given some spotters. Okay, let's get started. General pharmacology. So there's a lot of theory here. Abbreviations, what is solid dosage form, liquid dosage form. See guys, understand one thing, dosage is actually the solid or liquid. Actually it should be dose. Dose is the calculation, okay? So dose calculation it should be. See, this is correct. Dose calculation. Dose denotes the quantity of the drug. Dosages will be like liquid or solid or etc. Okay. So there are a lot of formula here. You will have to use these formula and apply all this. Now let's go to this one. Routes of drug administration. So this is where your dosage comes, isn't it? So you have enteral and parenteral. Parenteral means what? You're not going enteral. That's it. That is parenteral. Like IV, IM, SC, all this will be parenteral because you're going not via the oral route. Okay guys, is it clear? Oh, it's clear. Good. You want to say something? It's perfect. Okay, very good. Very good. Oh, nice color sections here. First time I'm seeing color in the record. What is this? Adverse drug reaction reporting form. That's nice. They put a colored form here. Look at this graphs, guys. What graphs are these? Bioavailability. Actually, it is better to use color for these graphs. You can understand very easily. Plasma half-life. So some graphs they have given here. What is this, guys? Relative efficacy, percentage response, drug A, drug B. So potency, efficacy, all that you can calculate. Let's move on to the next chapter here. Have I stuck some sheets? Essential medicine, guys. So the basic number of basic things that you should have in a particular countries, district, state, or a hospital or a PHC. Antimicrobial use and surgical prophylaxis. So basically, before a surgery, you want to give antibiotics, etc. to prevent infection, isn't it? So these are the commonly used antimicrobials. Amoxicillin, ampicillin, etc. How to take consent, guys. Informed consent process. This is experimental pharmacology. How the pupil dilates, how the pupil constricts. Oh, this is normal. So this is the meiotic effect. So sphincter pupillae is helping, isn't it? So sphincter pupillae constricts, right? So which drug will you put and what will be the effect? All that you will have to do here. So what drugs are they giving here? And the amount, the time that it has taken, is it light reflex, corneal reflex, pupil's diameter. They have written the pupillary reflex here, pathway of light reflex. So what is this, baby? Do you know what this is? Eye. This is eye. From the eye, the kind of signal is going to the brain. This is the brain, okay? Yeah, this from the eyes, the signal is going to the brain, okay?
But shouldn't the brain be up?
Brain, we are seeing from up. See, this is the eye, right? We are looking from up.
Is the brain?
Yeah, we are looking from up of that person's head like that.
Oh.
Yeah. So this is frog heart. So what are they putting here? What drugs are they talking about? Adrenaline, calcium chloride. Oh, they're talking about propranolol, is it? Excess calcium chloride, if you give, what will happen, guys? Calcium, excess of calcium, think about it. This is cardiac depressant they are giving here. The drugs they're talking about are acetylcholine, potassium, verapamil and atropine. See, they are giving here potassium. Depressant. Let's go on. Some photos there here, which is nice. This is the dog. Okay, but this is old. We don't do all this now. It's also nice. They put some colored photos here of the heart rate and the, what are these? Heart rate and blood pressure. Blue is the blood pressure and red is the heart rate. Nice, no? Blue is blood pressure, baby. And red is the heart rate. See, sometimes the blood pressure increases, but heart rate decreases. Sometimes the heart rate is like...
Wait, so when it's up and down, is that okay? Like, is it some problem? Or is it okay? It's correct only.
If it goes beyond some level, it may be a problem. Little is fine, I think.
The problem here, is it beyond?
I don't think so. It's beyond, because I don't think they gave so much of dose. Then we have rat experiments also. What is this one? Dose response curve, DRC. So basically that will show how much dose you give and how much response will be there, kind of a thing. We actually have to do all this even on rats. Okay, then. So looks like they have left a lot of empty pages here, but they have stuck a lot of pages because they take the notes on white sheets and they just stick it in the record, looks like. Okay. So these are some spotters like antithyroid drugs, where they act, etc. And what is this one? Inhibition of cell wall synthesis. What is this? What drug is it actually? Antimicrobial action, guys. So we're done looking at this record pharmacology. Say bye.
Bye.